Did you know that a peanut accidentally inhaled into your airway is more likely to enter the right lung than the left? Why does this happen? Understanding the anatomy of trachea, bronchi, and bronchopulmonary segment will answer this and many other clinically important questions. Let's explore the anatomy of respiratory apparatus in a simple and systematic way. The respiratory apparatus is consist of the conducting part, that is nose, nasal cavity, pharynx, larynx, trachea, bronchi and bronchioles. Then the respiratory part, that is respiratory bronchioles, alveolar ducts, alveolar sacs and alveoli. The main function is air conduction, filtration and humidification, gas exchange, voice production, etc. Trachea. It is a fibrocartilaginous tube connecting the larynx to the main bronchi. It begins at the lower border of the cricoid cartilage, that is the C6 vertebra, and ends at the sternal angle, T4 to T5 vertebral level. Length is approximately 10 to 12 centimeter. Diameter is approximately 2 centimeter. Features: it consists of cartilaginous rings, that is 16 to 20 C-shaped cartilaginous rings. Helps to protect and maintain the airway open. Also, trachealis muscle. There is a piece of smooth muscle connecting the ends of incomplete cartilaginous rings. Functions are: it narrows trachea during coughing, allows expansion of esophagus during swallowing. Relations: anteriorly thyroid isthmus, sternum. Posteriorly esophagus. Laterally thyroid gland and common carotid arteries. Next is tracheal bifurcation and carina. Trachea divides into right and left main bronchus. This occurs at the sternal angle T4 to T5 vertebral level. Carina is the cartilaginous ridge at the bifurcation. Clinical importance is that it is highly sensitive area. Foreign bodies can trigger violent coughing. It is the landmark for bronchoscopy. This is main bronchi. Right main bronchi. It is wider, shorter and more vertical. Length is about 2.5 centimeter. Clinical importance is that aspirated foreign bodies commonly enters the right bronchus. Next is left main bronchus, which is narrower, longer and more horizontal. Length is about 5 centimeter. Next is bronchial tree. The main bronchus divides into lobar bronchi, the secondary bronchi. In the right lung, it is divided into superior lobar bronchi, middle lobar bronchi and inferior lobar bronchi. In the left lung, it divides into superior and inferior lobar bronchi. Now this lobar bronchi divides into segmental bronchi, that is a tertiary bronchi. This is the one which supplies bronchopulmonary segments. Segmental bronchi divides into bronchioles, then it further divides into terminal bronchioles, then to respiratory bronchioles, then to alveolar ducts, finally alveoli. Bronchopulmonary segments of right lung. In the upper lobe, apical, posterior, anterior. In the middle lobe, lateral, medial. The lower lobe, superior, medial basal, anterior basal, lateral basal and posterior basal. Total 10 segments. Next is bronchopulmonary segments of left lung. The upper lobe, apico-posterior, anterior, superior lingular, inferior lingular. In the lower lobe, andromedial, lateral basal, posterior and superior. Usually 8 to 10 segments. The clinical importance of bronchopulmonary segments. The first one is segmentectomy. That is, disease segment can be removed without affecting the entire lobe. Another thing is that in tuberculosis, it may be confined to a segment. Lung abscess also, it may be localized to a segment. Bronchoscopy, these segments help to locate the lesions. In case of aspiration, foreign body usually enters at right bronchus and also right lower lobe bronchus. Next is blood supply of the bronchial tree. It supplies by bronchial arteries which supply bronchi, connective tissues and visceral pleura. Usually 2 left bronchial artery and 1 right bronchial artery. Originates from the thoracic aorta. Venous drainage. Bronchial veins drains into azygos vein and hemiazygos vein. Lymphatic drainage. The lymph passes through pulmonary nodes, then to bronchopulmonary nodes, that is at the hilar region, then to tracheobronchial nodes, then to paratracheal nodes, Finally, bronchomediastinal trunks. The clinical prevalence is that it is spread of the lung cancer and also enlarged hilar lymph nodes. So, the trachea, then the main bronchus, lobar bronchi, segmental bronchi, then bronchioles and alveoli. And remember, bronchopulmonary segment equal to segmental bronchus plus pulmonary artery branch. If this video helps you understand respiratory apparatus basics, don't forget to like, share and subscribe. Thank you.